chronic, eventually it damages the liver. You could end up with liver cirrhosis, just like somebody who's an alcoholic, right? All right. So in order, we want to get down to how we treat things now, okay?
Right. How we treat it. Yeah.
How we treat it. So
because
most people eventually get overweight, are obese, I think the most important thing is regular chronic exercise. That is what I tell my patients, okay? So they should start with just, I normally check their height and their weight and work out their body mass index. So we have that as a baseline. Then I will give them a cocktail of things to do and for at least 4 months, and then they return in 4 months. And the first thing I want to see is the weight, to see if the weight coming on. Because if they comply and do all the things I ask them to do, the weight will start to come down. All right? And if people wasn't having period, most of them will start to have period. If the period was irregular, the period will start to get regular. All right. So the first...
and that is without medication?
Without any medication. So the most important thing is regular chronic exercise. People need to start to walk for at least half an hour and try to do that every day. And as you get fitter, walk faster for the same half hour or walk longer. So you have to increase the load. And if you find that you're walking now really fast, sweating, breathing heavy, and you're going for like all an hour and thing, that is very good. But then you could start, once you get fitter like that, you should start to add weight training, which is called resistance training. Remember last week we talked about weight training, and that the weight, if you're lifting weights, then you build muscle as opposed to fat. So you have the fat compartment and the non-fat compartment. So your weight could remain the same, but if you reduce the fat compartment and increase the non-fat compartment, you're in a better metabolic state. The non-fat compartment is muscle, bone, cartilage, ligaments, all those kind of things. Okay?
Yeah. So someone asked, Doc, to that question, if you have been diagnosed with a PCOS and the doctors prescribe metformin and birth control. Okay.